A lot of clients come to me when they've been told by other therapists that nothing can help them, or they've felt really just let down by, the mental health system in one way or another. And so the majority of my clients come to me on a range of hopelessness to suicidal ideation or a history of attempts. And so maybe they've done years of talk therapy and feel like they keep hitting a wall. The ketamine treatment really takes it to this next level and allows the client to do this even deeper work. I have seen clients go from suicidal every single day to living like a pretty productive life within 5 or 6 sessions. I have a client who hadn't been able to work due to the severity of their mental health struggles, is now working a part-time job. So it's been amazing actually to see the transformation. The majority of the clients that I have done KAP with, it has been really significant change in a relatively short amount of time.
One of my particular clients was a Marine veteran of 10 years and also a police officer for 10 years as well. And when they were getting to the point of retirement, that's when they sought out using KAP or treatment. They had done talk therapy, they had done couples counseling, but a lot of substance abuse around alcohol being the norm for them to numb or self-soothe. This particular client had witnessed a lot of trauma during their time when they were in law enforcement, having to, witness people burned alive, things like that, like things that you can't unlearn. And it was very interesting because before leaving the military, this client felt okay. But after leaving law enforcement, because of the acute trauma that continuously happened, there was never any space between, whereas military, there was space between deployments. There was time to kind of come down a little bit from what they were seeing. And there was a validation of, I'm in the States, I'm okay. Whereas with law enforcement, this client couldn't come down because they were still in the neighborhood that they still worked in. When they would go out in public, the hypervigilance became so increasingly paralyzing that this client really avoided going to the grocery store, avoided going out for celebrations. And as we started working together, we focused on the integration first, really not pushing the medicine part. And this client had their own beliefs around it because ketamine, what they had seen was usually from the street. And so not really understanding how it could be beneficial, but curious. That was a big part of it. They were curious enough to explore it. And with that, we were able to do 3 sessions with ketamine, and they were able to actually connect with their old self, is how they described it, the self before the trauma happened, before all these experiences happened, and realizing that those experiences were not who they were. They didn't have to be hardened to hold them, and they were actually allowed to release them. And it was interesting to see the progression within, again, the family system, being able to be around their kids again, where they didn't feel like they were going to harm them with the trauma that they had, being able to talk with their partner about their feelings, which within the military culture and law enforcement culture, those are usually very, it's taboo to talk about that, but being able to express their grievances rather than having it get pushed down for so many years, or when they would have these blow-ups, and that was the big piece, was they were scaring family members at that point. And so being able to get them to a place where they felt okay to articulate their feelings in a healthy way, and then felt validated, that was huge. And I think that helped this client, and not just for themselves, but also being able to normalize seeking help for their colleagues, for people that they had served with. So within that, it was just a pebble, and it created a ripple within that person's community of healing versus holding on to the pain and suffering.